Hi, Carlos. So let's go over the format of history when it comes to interviewing patients based on Schwartz 2021.
Okay, I'm ready.
So to obtain a patient's history, we want to take a patient-centered approach so that we evaluate each patient holistically. There are 11 parts. The first one is source and reliability. So who, what, and where is the data coming from? This includes the age and gender of the patient. We also document who is translating if a translator is used and identify the family member if a family member helps with the interview. We also want to observe if the patient is competent to proceed with the interview, which is determined by assessing if the patient is oriented to person, place, and time. Second is chief complaint, which is the patient's reason for seeking medical attention.
And this is best by directly quoting the patient when asked, "What brings you in today?"
That's correct. The third part is history of present illness and debilitating symptoms. History of present illness relates to any recent changes in the patient's health that has led the patient to now seek medical attention. So it's information pertaining to the chief complaint.
And so debilitating symptoms is asking if there are any symptoms that have a debilitating effect on the patient, like pain or nausea.
Yes. So as a nurse, you would ask, how has your problem interfered with your daily life? Fourth is past medical history, which is assessing the patient's health before the present illness. This includes past illnesses, surgeries, allergies, immunizations, history of substance abuse, diet, sleep patterns, and current medications. Fifth is health maintenance. During this part, we are identifying how the patient manages his or her medical, social, and psychiatric problems.
So they'll be asking them if they visit their primary care provider regularly, if they get their eyes checked, asking when they had their last dental appointment, having them describe their exercise habits.
All those are spot on. Yeah. Six is occupational and environmental history. We ask about the patient's occupation and the environment that they live in because we're concerned if and how much exposure the patient has had to substances that may lead to diseases. Seventh is biographic information. We don't want to make any assumptions. So this is when we ask the patient for their date and place of birth, sex, race, and ethnic background. Eighth is family history, which is health information about the patient's immediate family. Ninth is psychosocial and spiritual history. Psychosocial history is information about the patient's education and personal relationships because we're assessing the patient's lifestyle. A good way to seek this information is by saying, tell me about yourself, like your background, education, and work. Spiritual history is assessing what gives meaning to the patient's life and how they cope, like through prayer or meditation. 10th is sexual, reproductive, and gynecologic history. This is important because sexual drive is an indicator of well-being. This is also a good time to provide education on safe sex practices and STIs. Now, for a woman, the reproductive and gynecologic history obtains information about her age of her first menstrual period, the regularity of menstrual flow, and duration of periods. For a man, we inquire about his sexual interests, function, satisfaction, and any sexual problems he may have. And then 11th is review of systems. This is a series of yes or no questions that identifies any signs or symptoms the patient may be experiencing in each organ system that has not been talked about yet during the history of present illness or medical history.
And this is usually done from head to toe.
Exactly. So we've gone through how information is obtained by using the patient-centered format of history when interviewing patients. Any questions you may have?
These 11 parts all make sense. Thank you.
You're welcome.